Bismillahirrahmanirrahim. Assalamu alaikum. This is me Nazir Ahmad from Pakistan. Today our topic of discussion is mechanism of drug absorption. If you are new on my channel, please subscribe to my YouTube channel and press the bell icon button so that you may not miss any upcoming video. Mechanism of drug absorption. Depending on the chemical properties, drugs may be absorbed from the gastrointestinal tract by passive diffusion, facilitated diffusion, active transport, or endocytosis. Passive diffusion, the movement of drug from a region of high concentration to one of the lower concentration without a carrier involvement, which is not saturable and shows a low structural specificity, is called passive diffusion. The driving force for passive absorption of a drug is the concentration gradient across a membrane separating two body compartments. The vast majority of drugs gain access to the body by this mechanism. Water-soluble drugs penetrate the cell membrane through aqueous channels or pores, whereas lipid-soluble drugs readily move across most biologic membranes due to their solubility in the membrane lipid bilayers. Facilitated diffusion. Drugs can enter the cell through specialized transmembrane carrier proteins that facilitate the passage of large molecules. These carrier proteins undergo conformational changes, allowing the passage of drugs or endogenous molecules into the interior of cells and moving them from an area of high concentration to an area of low concentration. This process is known as facilitated diffusion. It does not require energy, can be saturated, and may be inhibited by a compound that compete for the carrier. Active transport. Energy dependent active transport is driven by the hydrolysis of adenosine triphosphate, which is capable of moving drugs against the concentration gradient from a region of low drug concentration to one of higher drug concentration is called active transport. This mode of drug entry also involves specific carrier proteins that span the membrane. A few drugs that closely resembles the structure of naturally occurring metabolites are actively transported across cell membranes using these specific carrier proteins. Endocytosis and exocytosis. These types of drug delivery systems transport drugs of exceptionally large size across the cell membrane. Endocytosis involves engulfment of a drug molecule by the cell membrane and transport into the cell by pinching of the drug-filled vesicle. Exocytosis is the reverse of endocytosis and is used by cells to secrete many substances by a similar vesicle formation process. Vitamin B12 is transported across the gut wall by endocytosis, whereas certain neurotransmitters, for example, norepinephrine, are stored in intracellular membrane-bound vesicles in the nerve terminal and are released by exocytosis. Thank you for watching my presentation. If you have any question, please write in the comment section below. Bismillahirrahmanirrahim. Assalamu alaikum. This is me Nazir Ahmad from Pakistan. Today our topic of discussion is mechanism of drug absorption. If you are new on my channel, Bismillahirrahmanirrahim. Assalamu alaikum. This is me Nazir Ahmad from Pakistan. Today we will learn about routes of drug administration. If you are new on my channel, please subscribe to my YouTube channel and press the bell icon button so that you may not miss any upcoming video. Routes of drug administration has been divided into almost 9 categories overall. So the major categories are systemic and local. Among systemic, there are further two subcategories like enteral and parenteral. Enteral has 3 classes and parenteral has 5 classes. We will start from enteral. Enteral have oral route, sublingual route, rectal route, and parenteral have intravenous route, intramuscular route, subcutaneous route, transdermal route, inhalation route. Let's start from enteral route. Enteral routes of administration are those in which the drug is absorbed from the gastrointestinal tract. Oral route is one of the category of enteral route. Oral route is a route of administration where a substance is taken through the mouth. Absorption pattern of oral route. It is variable and affected by many factors. Advantages of oral route. Safest and most common, convenient and economical route of administration. Disadvantages of oral route. Limited absorption of some drugs. Food may affect absorption. Patient compliance is necessary. Drugs may be metabolized before systemic absorption. Number 2, sublingual route. Sublingual route involves placing a drug under your tongue to dissolve and absorb into your blood through the tissue there. Absorption pattern of sublingual route depends on the drug. Few drugs, for example nitroglycerin, have rapid direct systemic absorption. Most drugs erratically or incompletely absorb. Advantages of sublingual route. Bypasses first pass effect, bypasses destruction by stomach acid, drug stability maintained because the pH of saliva relatively neutral, may cause immediate pharmacological effects. Disadvantages of sublingual route. Limited to certain types of drugs, limited to drugs that can be taken in small doses, may lose part of the drug dose if swallowed. Number 3, rectal route. Rectal route uses the rectum as a route of administration for medication and other fluids which are absorbed by the rectum's blood vessels and flow into the body's circulatory system, which distributes the drug to the body's organs and bodily systems. Absorption pattern of rectal route. It is erratic and variable. Advantages of rectal route. Partially